Well, good afternoon. I'm King County Executive Dow Constantine. President Obama himself has emphasized repeatedly his concern about what can only be called a national heroin epidemic, one that is causing pain and death in every region of the country, including ours. In fact, when he was in town just last fall, he spoke directly to Mayor Murray and to me about his concern about the emerging heroin epidemic and its relationship to homelessness throughout the country and in our community. More Americans now die from drug overdoses than die from car crashes. Here in King County, more people now enter detox for heroin than enter treatment for alcohol. And they are suffering from withdrawal at younger and younger ages. In 2014, opiate overdose deaths were the highest ever recorded in King County. 3 times what they were in 2009. Even as steps are taken to drive down the overprescription of opiate painkillers, more people have become addicted to street heroin. Our experts believe that the heroin epidemic is one of the root causes of the sharp rise of homelessness in our region. And it is the leading cause of death among the homeless. And unlike the spike in heroin addiction that we experienced here in the 1990s, which was mostly contained to Seattle, this wave is hitting every community across King County, sparing no race, no age, no gender, no neighborhood, no income level. People in our community, including preteens, are dying on our streets and overdosing in homes in every zip code in King County. Our state has one of the weakest safety nets for those who need help, leaving all of our cities and communities vulnerable to this epidemic. We are standing in front of an addiction treatment center. It closed last year, but it was recently sold to Valley Cities, and thanks to funding from King County, will be renovated, and this summer will reopen to provide 60 much-needed beds for detox services and residential treatment. This is an example of King County's efforts to build treatment capacity. We continue to call upon Congress and upon our state legislature to adequately fund homelessness and health and human services. In the meantime, there are actions we can take to improve outcomes with our existing resources. That's why today Seattle Mayor Ed Murray and Auburn Mayor Nancy Backus and I are announcing that we will co-convene a heroin and prescription opiate addiction task force, bringing together a team of experts who will recommend actions we can take to confront this epidemic now at the local level. The task force will have 30 members representing a wide range of disciplines: public health and human services, police, prosecutors, and public defenders, physicians and hospitals, UW researchers and local schools, tribes, cities, treatment providers, and more. And we have elected leaders who are making resources and expertise available to help us succeed. So I want to thank Mayor Backus, who's here with us today. I want to thank Renton Mayor Dennis Law. Over the next 6 months, this team is going to create a short and long-term action plan to align our resources around our shared goals, to increase access to life-saving treatment, to prevent people from becoming addicted in the first place. I'm confident that we can succeed because we know already what works. There are evidence-based tools and interventions that can prevent fatal overdose and treat addiction. We'll apply a prevention-oriented public health approach, one that builds on public awareness and focuses on delivering the right treatment at the right time at the right place. This is critical. Delivering treatment on demand when a person with addiction reaches out and asks for help. is the most effective, least expensive way to achieve recovery. Yet our current lack of treatment capacity leaves at least 150 people who've asked for help waiting every day to get that help, to fight their heroin addiction. Too many people are ending up receiving treatment in hospitals and in jail, places that are the most expensive to provide this service. This task force is modeled after one that Governor Inslee and I created to dramatically reduce psychiatric boarding at local hospitals. That task force will present its final report in June. And we already have stronger alternatives to hospitalization in place, more treatment beds available in the community, and more effective protocols for assessment and for placement. More people who need help with mental illness are getting the right treatment at the right time, at the right place. And we will now work together to achieve the same results for those who need help with heroin and with prescription opiates. I want to thank the members of the task force for joining us today and for contributing their time and their resources and their expertise and experience to this urgent cause. And I'd like to now turn this over to my partner in this task, Mayor Ed Murray.
Well, thank you, Dal, for your partnership and your leadership, and Mayor Backus, thank you as well for your partnership and your leadership. Our cities and the county have an opportunity to move into the forefront in our response to this national heroin epidemic. Frontline recently did a report, and it involved Seattle, and it pointed out that the victims of this epidemic are suburban moms, they're star high school athletes, there are veterans returning from overseas. And it's not just a Seattle problem. It exists in our suburbs and in our rural areas and across the nation. That is why I joined Executive Constantine in thanking the President for his attention to this national crisis. The President has proposed $1 billion in federal funding so that we can assist our families and our individuals at risk, regardless of their income, their ethnic or racial background. You know, our outreach providers and our police officers who go into unauthorized encampments to try and assist people tell me more and more the folks that they see are addicted, and most often to heroin. It's very dangerous to conflate homelessness with addiction, but there is a segment of our homeless population that are significantly addicted and driving up the numbers of our homeless. But there are other reasons for homelessness: mental illness, veterans who are not getting homes when they come back here, and income inequality. I just mention that because I don't want us to lose perspective to think that we can solve the homeless problem by solving a heroin epidemic problem. But we can make a significant impact in that homeless issue if we make a significant impact in this heroin addiction that we see. And we see it every day. We see it on our freeways, we see it under our freeways, we see it on our streets. This city and this county have been leaders with things such as the needle exchange, methadone treatment, chemical dependency services, the mobile medical van that we're launching on our streets, law enforcement assisted diversion, and housing first. But let me join the executive in reminding people that we, the city and the county, can't do this without a significant increase in state and federal assistance. I am so glad that the executive is taking leadership to launch this task force. It will look at how can we improve treatment, how can we expand treatment, what prevention efforts work the best, how can we prevent the heroin-related deaths that grow constantly, and how also do we address addiction when it touches on property crime. These are all interconnected, but I believe that this task force, by addressing this very significant problem in our cities and in our county at this point, as I said in the beginning, gives us an opportunity to help cities around the country and counties around the country to figure out how we address this epidemic. And now let me introduce the Sheriff of King County, who deals with this problem and whose men and women deal with this problem every day, John Urquhart.
Thank you, Mr. Mayor, and I assume I was invited here to talk about the war on drugs. After 40 years of work as a police officer and many of those years as a narcotics investigator, fighting that war on drugs, taking people to jail on a regular basis, fighting the war on drugs, I think I can say with some assurance that it hasn't worked. Guess what? The war on drugs hasn't worked, and we need to try something different. And as a police officer, we think of ourselves as a hammer. And the cliche is, when you're a hammer, every problem is a nail. And we've been very good at pounding that nail. And we've got to stop doing that. So my message today is really more for not so much the police chiefs in King County, because they're really pretty good, but the police chiefs across the state of Washington. We have to do something different than we have done for the last 50 years when it comes to fighting drugs. And we've gotten pushback. I've gotten pushback. The profession has gotten pushback from other police chiefs. Oh my God, needle exchanges? Are you kidding me? We can't do that. Legalize marijuana? It's a gateway drug. We can't do that. Needle or safe injection sites? Are you kidding me? We certainly can't do that in King County. Well, we have to look at things differently. We have to take a different take. We have to look at harm reduction. And we have to think of things that haven't been done before. That's the only way we can fight this scourge. Harm reduction and looking at addiction not as a crime problem, not that something that the police should be handling, but something that realizing it's a health problem and addressing it from that standpoint. And until we, primarily the police, make that mindset change, we will never succeed and things will not get better, they will only get worse. And I don't want that to happen. So thank you very much for having us here. Thank you for your leadership. And let me introduce the Mayor of Auburn, Nancy Backus.
Thank you, Sheriff. I'm honored to be here today standing beside Executive Constantine and Mayor Murray and members of the task force to discuss the crisis facing King County. Admitting they're a problem is the very first step in solving it. This takes bold leadership, and that's what we have here. We have bold leadership that's willing to convene a task force to address the issue. And as you'll see by the makeup of the task force, this is a very complex problem. There are no single solutions, but ones that we need to work on together. While Seattle has been in the media spotlight, I can tell you that South King County is very familiar with the issues and the need for treatment, and those are great. And quite frankly, the availability of resources are minute in South King County. We did not hesitate when we were asked to participate in this effort, and our police chief, Bob Lee, has shared with me his frustration knowing that the drug-addicted person that is taken off the street one day will only be back out on the street a short time later. And I'm hearing the same thing from our local emergency room doctors and firefighters. We're not getting to the root of the problem by arresting or with emergency room visits. It's been noted recently that our jails appear to be our _1 mental health provider. It seems they are also one of our largest detox providers. And that's a very expensive and ineffective way to handle this problem. Auburn is very familiar with the great work of Valley Cities. In fact, we are home to a few of their projects. They are well known to us, and I can vouch for the great work and the qualifications as we work towards long-term and short-term effective solutions. We simply don't have the luxury of sitting back any longer and pretending this problem doesn't exist or that someone else is going to solve it for us. It's our responsibility to work together with the experts to identify both long and short-term solutions. As we stand here today, I find myself hopeful, knowing that we are in this battle together. Now I would like to introduce Norm Johnson, who is a local treatment provider at Therapeutic Health Services, as well as a task force member.
I'm very happy you used the word hopeful, because believe me, that's what kept me going for 40 years. And I'm still looking forward to working with the task force. And I'm especially happy that the county exec and the mayor together have supported this task force. It's been long coming, and I've been wondering what you were doing. Well, here it is. In 1970, I thought I'd start with something a little light. In 1970, some of you were here, the cartoon character Pogo said, "We have met the enemy, and the enemy is us." And that is true today, 50 years later. Today we are fighting a monumental enemy, heroin, an enemy that makes no distinctions, affects everybody from Yale, and they sound corny, but to the jail. We have effective resources to fight this problem. I am absolutely convinced that the task force, with the charge it has, with the resources that are available here in King County and in the city and throughout the state, can meet the challenge of this epidemic. I don't like to use the word epidemic, but everybody else is using it, so I make it so, because it seems like it's something you can't overcome. It is doable. We have fought other fights like this before, and we will do it again here, and we will be successful. I have the pleasure of knowing many of the resources after 40 years being in this field. And one of the key resources at the University of Washington. And I would like to introduce to you a gentleman by the name of Caleb Baton Green, is an affiliate associate professor in the University of Washington Department of Health Services. We'll get this going. And he's the senior research scientist in the University of Washington's Alcohol and Drug Abuse Institute. He published research focused on drug epidemiology, health services research, youth substance abuse and prevention, drug overdose prevention, and drug treatment services. And with his lead and the lead of other people in this community, and I have to point out one of my favorite people, because we fight, but we get things done, and that's Jim Volendroff. Jim has a tough job trying to deal with those of us who provide the services, trying to get along with public health, trying to get along with all the agencies. But I want to thank both the county exec and the mayor for his leadership. Thank you very much. Khaled?
Thank you very much, Norm. I think I first met Norm about 1995 when I personally first started working with heroin users and understanding what their lives are like. And so what I've always tried to do in my research is do all the numbers, get all the evidence, but then also remember to talk with human beings impacted by addiction and find out what they really need and want. And so let me tell you very briefly a little bit about what I think is going on out there. Really important for people to understand is that opiate addiction is a medical condition, and that it is a potentially fatal medical condition. We had 3,097 people die from opiate overdose in King County from 1997 through 2014, more than 3,000 people. 72% of drug overdoses involve opiates, prescription opiates and/or heroin. In 2000, we had a heroin task force. I was not on it. I was doing other things. So a main result of that task force was an increase in capacity for methadone maintenance treatment. And we saw a strong association with a decline in deaths for many years after that. Parallel to that, we saw an increase in opiate prescribing, and soon after that, prescription opiate abuse. By 2010, we were seeing an increase in heroin addiction again. The good news is that tools are increasingly available. The opiate overdose antidote naloxone is much more accessible now. The Washington State Good Samaritan opiate overdose law to encourage people to call 911 took effect in 2010, and Sheriff Urquhart spoke about it just last week on the news, reiterating the importance of people calling 911 during an overdose. Back in 2002, buprenorphine, a newer medication, was approved for addiction treatment. And this medication can be used by physicians out of their offices, out of their clinics, to manage the addicted patient. Research shows that people being treated with methadone or buprenorphine are 50% less likely to die of an overdose. We don't have many chronic medical conditions that we can reduce mortality by 50%. So we have tools, but we also have tremendous unmet need. My personal hope for this task force is that we will be able to radically rethink how and where we provide care for those addicted to opioids. We need to dramatically increase the amount of care, but also figure out new ways to reach out into the community to provide that care. Expecting a homeless person addicted to heroin to navigate our complicated bureaucratic system is unfair and unrealistic, and it doesn't happen. We have the tools. I'm excited to work with this task force to figure out how we can take action to improve the lives of those addicted to opiates, their friends and family, and the communities in which they live. So with that, I'll introduce Dr. Jeff Duchin, the Health Officer for Public Health Seattle-King County.
Good morning. I'm Jeff Duchin. I'm your Health Officer, Public Health Seattle and King County, and I'll be one of the co-chairs of the task force. As you heard this morning, we're in the midst of an unprecedented epidemic of opiate addiction and overdose caused by prescription pain medications and heroin. And this epidemic constitutes an increasing public health problem. Prescription pain medication and heroin addiction is a chronic disease, like cardiovascular disease or diabetes, that is difficult to treat but can be effectively treated. Injection opioid addiction is associated with high rates of morbidity and mortality, including structural and functional changes in the brain, and life-threatening bacterial infections of the heart, the lungs, other organs, the skin, HIV, hepatitis C, hepatitis B infections and injuries, and in pregnant women, complications of pregnancy and labor, and babies that are born dependent on opioid drugs and in withdrawal. We need to fight this as we would any other chronic disease epidemic with a multifaceted public health approach to help people that are already addicted get and stay in treatment as long as they need it and prevent people from getting addicted in the first place. Punishment and stigmatization are not useful cures for any disease. We can help people who are already addicted through increasing access to treatment and integrating treatment into healthcare settings through overdose prevention by expanded access to naloxone, by addressing coexisting medical and social needs to make success of treatment more likely, and through reduction in harm like syringe exchange to improve health outcomes and prevent deaths by preventing overdose and infections from injection-related causes and providing an access point for addiction treatment, medical and social services. We can identify persons who are abusing or addicted to opiates early to prevent addiction and transition to injecting drug use. And finally, we can prevent people from becoming addicted in the first place by targeting the excess availability of prescription pain medications through the enhanced use of prescription drug monitoring programs and the development of clinical guidelines through educating families to safeguard prescribed drugs and through family and community-based abuse prevention programs. I'd now like to introduce a special speaker to you. This is Thea Oliphant-Wells. She's one of the social workers with our department. She's going to talk to you about her work and also about her personal struggles and recovery from opiate addiction. Thank you.
Hi, it's chilly today. Thank you so much for allowing me to be here and for your focus on this issue. I'm excited to see the widespread support for finding solutions for people I care a great deal for, both professionally and personally. 10 years ago, I was homeless and addicted to heroin. The stigma associated with opiate addiction and injection drug use plagued my interactions with those I sought help from. Like many addicts, I had used drugs to escape the traumas I'd experienced in my life. The shame of my existence was ever present. Those who helped me most on my journey in recovery were those who did so without judgment. The staff at the needle exchange, loving nurses at Swedish Hospital, a compassionate social worker at DSHS, my treatment providers, my recovery communities, and the Oxford house I like to say I grew up in. I had access to the type of treatment I wanted and what I believed would work for me. I had the love and support of my family. I had general assistance welfare, which at that time was enough to pay for a room in clean and sober housing. And I was able to focus on my recovery and my treatment goals and get better. I went from being a high school dropout with a GED to achieving a master's degree in social work from the University of Washington. I'm now working as a social worker at the Public Health Needle Exchange in Seattle, helping other people like me. Every day I see my clients facing obstacles that seem impossible to overcome. They face stigma and judgment everywhere they go, and they're told they should be ashamed, and they are. If you ask me, and thankfully somebody did, we need a variety of treatment options available on demand. One size does not fit all, and we need to have help available when people reach out for it. We need safe and affordable housing options. How many of us can address our healthcare concerns while living in a tent, or a car, or a doorway? Long wait times or arduous processes for accessing treatment make it difficult for people to get the help they need. Treatment options are most attainable by folks with more resources, and many are left out who don't have money, phones, reliable transportation, health insurance with adequate coverage, or who have the organization to follow through and keep track of all the hoops they need to jump through and in what order. I'm so grateful to have had the help I needed to heal and to move in the direction of my dreams. Thank you for coming together to stand with us. That old saying, once a junkie, always a junkie, is a lie. Opiate addicts can and do recover. Thank you.
Thank you so much for sharing your story and for your work on behalf of others. It is remarkable, and it's wonderful to have a great advocate like you here with us to help lead this effort. We are able to take your questions. I'm going to rely very heavily on Dr. Duchin and others for any technical questions, but who has questions for us?
I have a question.
Yes.
So, as you've said, you're sitting here, we're amid a lot of people who have expertise in this. Why do you need a task force to do something? Couldn't you do something in another way or do something right away? And also, do you have a timeline for how long it will take to do this?
So that is an extremely good question, because the traditional model would be for the government, in this case public health, to hang a sign above the door that says, solution to the heroin problem, open that door and expect everybody to come. What we are doing in this and homelessness and all of our other challenges now is creating partnership across the community, aligning all of those who have an interest in and are working on solutions toward a shared goal on that horizon, so that collectively we can move our community toward recovery. Getting all these folks on this task force to discuss the issues, where the gaps are, the potential solutions, and agree on a collective approach is really the critical part of the exercise. In September, this group is expected to present their recommendations to us, but we are not waiting to September to take more action. Just as we have done with the psychiatric boarding task force, at each step along the way, when there is new insight or revelation, when new opportunities are identified, we will take those steps immediately. And by September, it is my expectation that our system will be better equipped and better serving the people who need help in our community.
Presumably, people will not be dying between now and then while you're waiting for the task force to reach a conclusion.
No, as I say, as soon as we have resources or insight into things we can be doing better collectively as a community, we will take those actions. We are not waiting for a report in order to provide people all of the treatment we are able. Other questions?
What do you do for someone, it's probably a sizable part of the population, that would literally require civil commitment? People that don't want to go into rehab in one way. People cannot currently, as I understand, be committed for addiction, but we've had some conversations around this as a challenge. Do you want to try to discuss this?
And tell us who you are, sir.
Yes. Hi, good afternoon. My name is Jim Vollendruff, and I'm the director for the King County Behavioral Health and Recovery Division. So I'd appreciate if you could maybe repeat the question. I couldn't hear it all while I was over
Sir,
there.
what I was saying, and I'm sorry if you could spell your last name, but some people simply don't want to go, and those are probably sometimes the people most needing treatment.
Yeah.
Relative to some form of civil commitment, which both the nation and the country and what we don't believe in. How do you reach those people? How do you help those people?
Well, you bring up a very good point. And so one of the things that we believe is that some people are so compromised by addiction that their brain is literally hijacked by the drugs that they are taking. And so just like we have a civil commitment process for people who have mental health issues, we believe that there is a process around involuntary commitment for individuals who are so compromised by their addiction. And so in the legislature this session, there is a bill, House Bill 1713, which calls for the integration of mental health and substance use involuntary treatment laws to be combined so that when we go out and evaluate people, if in fact their problem is drugs and alcohol and they are so compromised that they are a danger to themselves or others, that we have the resources and the techniques to involuntarily detain people so that we can get them on that path to recovery.
Where is that bill right now?
That bill right now is in the House, and actually, I'd have to. I'm not exactly sure where it's making progress in the legislature this session. It was introduced last session by Representative Cody, and we're making progress on that this section.
And Deborah, we have our government relations folks here who know day to day what's going on in Olympia. They can talk to you.
Sir, while you're at the podium,
Yes.
you can just spell.
Yeah, it's Vollendroff, and that's V as in Victor, OLLENDROFF as in Frank.
And your first name again, sir.
Jim.
Thank you, sir.
Thank you.
I want to follow up on an important point there really quickly, and that is that while there are some people who desperately need treatment who don't want to go get it, the vast majority do. And I think there's a big misperception around that. We surveyed more than 1,000 injectors across Washington State last summer. 24% said they had no interest in getting help to reduce their use. The rest of people do want help reducing their use. And I think we need to recognize that. I think we have a misperception that people are out there having fun on heroin. In fact, that is not the case. The vast majority do not want to be using, and they do want help. We don't have resources for those who do want help right now. Just want to make that point.
Well, do you agree with the civil commitment part of it, or do you think that that's going too far?
I'm going to say the civil commitment part is beyond my expertise, Deborah. I do not know that topic well. I would defer it to Jim or Jeff on that. But I think the point is that we're talking about involuntary commitment. We have a lot of people who want treatment who can't get it.
Yeah, so this clinic, I believe, is the one that was declared bankrupt because of the financing model. So what's different now that this one might survive?
And we have people who can talk to you about how the financing model is changing as well. So which of our experts wants to talk about the financing model? Jim.
So the substance abuse delivery system has been significantly underfunded for years. Providers have been literally going out of business as a result of the Medicaid reimbursement rates. And although the Affordable Care Act was a great thing for us, the rates that Medicaid pays make it challenging for providers to hire adequate workforce and to survive, particularly in an urban setting like Seattle. And so we've been working with our legislature to increase those rates, and in fact have been successful. April 1st of 2016, King County will take responsibility for the delivery system of substance use disorder residential services, and we're raising the rates to make sure that providers have the resources that they need to survive and to recruit adequate workforces.
May I ask a question? I was talking to someone earlier who was saying the thing about heroin and opiate addictions is that they've always been hush-hush, that, we whisper about them, they're happening in the shadows and all of that. Is this a different day from your perspective? Here we are, we have the highest people in this county talking about this as though it's something that is urgent and urgently needed.
Well, first of all, everybody who still thinks that opiate addiction is primarily a criminal justice issue and not a public health issue, raise your hand, and we will talk to you after the press conference. This is something that needs to be daylighted. This is a health issue. It is not something where people should be afraid that the law is going to come down on them, nor should they be ashamed. What they should be is open to asking for the help they need to get their lives back on track. We, as a community, have the ability, we know how to help people with heroin addiction, but if they are driven into the shadows, either because of fear of criminal prosecution or fear simply of being ostracized, we're not going to be able to get them the help they need. So I would ask all of our community to embrace those who are struggling with these challenges, whether it's from prescription drugs that they become addicted to, or whether it's from heroin that has been sold illegally. embrace folks, help them connect with the help they need so that our entire community can be healthier.
Yeah, the idea of safe injection sites, the sheriff kind of touched upon it when he was talking about it. Seattle would become potentially the first in the country to do that if they were to open a site. I mean, is this something you would explore in King County? Mayor, I don't know if you want to address that instead.
Again, let me just say, as a general principle, I am interested in harm reduction, right? I'm not interested in moralizing. I'm not interested in blaming. I'm interested in having people become healthy, to remove the danger of illness and death, to help them get back on track and be productive members of the community. And whatever it takes to have that happen, I think is something we must consider.
And I want to reiterate that, excuse me, we need to figure out what works. If that works, if it reduces harms, if it saves lives, let's try it. Let's look at it. I'm willing to look at it in the city of Seattle.
May I ask the sheriff something? I mean, it seems to me that you have a higher bar than some others in trying to convince police chiefs and sheriffs around the state to look at this in a different way. Is this a part of your, what are you to do about that, where they believe these are criminals who should be in jail, or at the very least should be arrested?
Well, certainly not just in the state of Washington, it's across the country, and it is a high bar. And there need to be more sheriffs, more police chiefs that are speaking out on this issue, like I am doing today. But it's an uphill battle. You know, we've been doing things one way for 100 years, and certainly the last 50 years on the war on drugs. And people, my profession has to be able to look inside themselves and figure out it hasn't worked. It hasn't worked. Why would we keep doing the same thing? But that's a difficult thing to do for any profession, but certainly for mine. You know, we stand up there as the upholding the moral compass of America, and maybe that compass is not pointing north like it should be. So it's going to be difficult, but it has to be done.
Do you risk being accused of coddling people who should be treated in another way?
I've been accused of a lot of things since I've been sheriff, and that is one of them. Yes. Yes.
Deborah, 20 years ago, I tried to open a clinic in Snohomish County. Could not get any support from anyone who was in the police department or even in the council. About a year ago, there was a meeting held in Snohomish County. The room had about 35 people, which 30 of them were policemen from all the various small cities in that county. There has been an incredible change in the police force about working with us and trying to work with this addiction. So I'm happy to say it took time, but after 10 or 15 years, I have seen the difference of the participation and the support of the criminal justice people and the police in many of the cities in King County as well as in Snohomish County. And I think you're going to see that throughout the country.
So, time for two more? Yeah. Can I just add on to that? I'm sorry. There is, though, a role for the police, and an emerging role, I think, because they are coming into contact with people who are addicted. There might be people who are in crisis, people who are in the midst of an overdose, where they may be the only person there to be able to intervene. We want to give them the resources they need to be able to intervene. They may find someone who clearly needs help with an addiction. Our police officers should have the information, the contacts right there to be able to connect that person with the treatment they need. Police, EMTs, public health workers, everybody who is interacting with the public and may come across folks who it seems to them need help should have the resources they need to connect those folks with that help. Go ahead.
So I think you guys know, you talk about the solutions. Harm reduction is a big emphasis here. Can you put a dollar figure on how much money is needed to, meet that unmet need, and how do you find that money?
More? That's part of what the task force will discuss. This is about clearly the need for more resources. It's also about the need for us to use all of the resources, not just of the government, but of the community to the greatest advantage. And a lot of that is what I was just talking about. Everybody has to take ownership of this issue. It's not just for public health. It's not just for a hospital or for the police. This is for all of us to own, and when we are all helping to care for folks who are in need in our community and bring them to the treatment they need, we will be many steps closer to a solution to this. I don't know if you want to speak at all to the hard numbers on the funding, or if one of your folks wants to. This is Adrian Quinn. Come on up.
Tell us who you are.
My name is Adrienne Quinn. I am the Director of King County Department of Community and Human Services. One of the things that we have been doing as a county is providing capital dollars to open new treatment facilities. And so this facility right here is one that's being opened. We'll be opening a new facility in Kent that also went through bankruptcy, reopening it, and a new methadone clinic in Renton come this summer. So when you asked earlier about what's happening while the task force is working, these are the steps that we are taking. One of the reasons to have the task force is to provide treatment in different ways. We would like to engage the primary care medical community in a different way and provide treatment within primary care settings. There are medications right now that would be covered by Medicaid, by the Affordable Care Act, and if we are able to spread that treatment and make it more readily accessible, some people will seek treatment that may not otherwise seek it in another setting, and it'll be more accessible to people. So we can't put a specific dollar number on that. As Executive Constantine said, we will be seeing the holes in the system, but in the meantime, one of the focal points of the task force will be system change and engaging more partners in the community.
What are you spending now?
Our budget right now for actually, Jim, do you want to say the specific budget? Sorry, we're back to Jim again.
The budget for the Behavioral Health and Recovery Division is about $400 million, but that's across our psychiatric services and our opiate replacement programs. And so I'd have to get back with you with the specific number, but we have steadily increased the amount of resources that we're putting into opiate programs over the years. And again, I think that's part of the work of this task force, is to help us find that balance of what is the actual number in terms of resources we need to put towards this.
You have time for two more.
I'm Jim Washington, the medical director of the addiction program in Swedish, a member of the panel. Just last week at Swedish Cherry Hill, I rounded on 3 patients who had had a heart valve replacement due to injection drug use. Those heart valve patients spent a month in the hospital, and often each case costs $500,000.
Did you come over here, sir? Are you?
No, that's what I said.
You can talk to him after. Thank you. That's very, that gives us a lot of insight. So did you understand that the traditional model has been that this addiction treatment happens in its own silo? There's addiction centers, and then there's your doctor. It would be tremendously helpful if there was more of these addiction services being provided through your doctor, who has prescriptive authority for some of the most effective drugs to help with heroin addiction. And that would give us access then to more funds that are available through Obamacare. We are really looking to marshal all the resources in the community to not be burdened by the way things have been done in the past, but rather to find the way we need to do things today to take on this challenge. One more question.
I have a quick question. This is a law and order question. You know, right now we've got this guy in Mexico, El Chapo, that we're trying to extradite to the country here. Using him as an example, shouldn't someone like that literally be made an example of within our legal system when we get him here, to others, to say, this is what I'm going to have to deal with if I want to deal?
It's very important to distinguish people who are addicted to drugs, people who are using drugs, from people who are running illegal businesses, predating on those people who are addicted to drugs. People who are running an illegal business clearly need to be held to account for it. And he obviously has a lot more things going on than simply trafficking drugs. There's a whole suite of crimes associated with him. I'm not sure about, obviously the authorities are going to want to make an example of a drug kingpin. That's not what we're talking about here today.
No, but I mean, John, as an example, has said the war on drugs has failed. I understand from the way we've handled it, with the user. But I'm speaking, when you've got someone that brags that he has imported more heroin, more cocaine into the country, don't people like that, you know, doesn't something need to be done with them so in turn those that might consider replacing them say, I don't know if I want to go there?
The key, obviously, from our perspective, is driving down the demand. But there are people like him who need to be brought to justice. And the two issues, although related through the transaction, are otherwise pretty separate. I mean, am I...
To answer your question, the answer is yes.
And with that, so there, as you've seen, we have a crowd full of experts who know a lot about this issue. And I want you to take advantage of the opportunity, if you can stand the cold weather here today, to learn more about what we can do to help people in our community struggling with addiction. Thank you very much.